Hello, Dr. Vikki Petersen here. I want to speak with you today about something called cross-reactive foods and how you can be eating a food when you're gluten intolerant. So you have celiac disease or and you're gluten sensitive, and you're eating a food and you could swear there's gluten in it based on how your body's reacting, but the food in and of itself doesn't have gluten. So some of these are coffee, yeast, oats, dairy products. There's a longer list. There's rice and potato and a lot of the different grains. But the ones that are most concerning are those first four that I mentioned, the coffee, the yeast, the dairy products, and the oats. Because when it comes to cross-reactivity, let's define that term first. So what we're looking at is your immune system, when you're gluten intolerant, sees gluten and reacts to it. It's programmed to do that, and it causes inflammation and damage and disease and a whole host of problems. That immune system, what it's tracking, or the part of gluten that it's reacting to, is a segment of the protein. So it's the protein portion of the grains, wheat, rye, and barley. There's a lot of foods have protein in them, and in some foods that protein structure is very similar to that of gluten. So as an example, someone who's gluten intolerant might be very good on their diet, they're drinking coffee, and their body's immune system literally confuses the coffee for gluten. Okay? Obviously coffee is not glutinous, it has no gluten in it, but it has a similar protein structure, and for some, the body will react just like you ate gluten. So, not meaning to ruin your day, but if you're a gluten intolerant person who knows you're very good off gluten, you're being very strict on your diet, but you're not feeling the way you think you should feel, and maybe you sometimes feel like you got into gluten even though when you really review what you ate, there wasn't any gluten in sight. If this is you, then you really might want to check into these cross-reactive foods. So there's the lab that does the test is called Cyrex Labs. It is a blood test, so you need to get your doctor on board about doing it. If you want help from us, certainly let me know. We utilize the test. But the point is that of those four foods that I mentioned, 80% of the time, people who are reacting to them, it's a permanent type of thing, meaning staying away from it is not going to change the outcome. Now, as opposed to the rest of the 15 or 20 foods that are possibly cross-reactive, the way we treat those is we have the individual stay away from them for 3 months or so and then reintroduce them into the diet, and often they're fine with those foods after being given a break. Now, while we're taking a break from the cross-reactive foods, we're also strengthening the immune system in as many ways as we can figure out. We call this the secondary effects of gluten. It includes not only these cross-reactive foods, but hidden infections, unhealthy probiotics, imbalanced hormones, other internal infections that you can have. So there's a list of things that we call the secondary effects of gluten, and all of those need to be addressed. But for some, there can be a permanent problem with those four foods as I mentioned. Personally, I've never done well with coffee, and I recently discovered that oats are a nightmare, which was very sad because I was excited when gluten-free oats came out. But I like feeling great. You know, it's worth it to me to do that. So, is it going to be for everyone? No. If you love your coffee, might it be fine? Yes, it might be totally fine. But it would be very, very important for you to find out. So, I hope you found this informative. Let me know if you're somebody who you kind of know reacts to these things, but you never understood how that made sense. So maybe this clarified some things for you. And please do let me know anything, any questions you have, any other topics you want me to talk about, and any way I can help you, because we're here to help. So until next time, I wish you very good health.